Hi, nice to be talking to you again. I thought I'd just update you on where we are with Birthplace, the study that you're probably all aware of that looked into the outcomes for women choosing to have home birth, freestanding midwifery-led unit, alongside midwifery-led units or obstetric units for their care. We've obviously received the results and I think they're very positive. We're now entering into a series of meetings, and my hope is that the RCOG, the NCT and ourselves may be able to come up with a joint document around the policy implications arising out of the Birthplace study. I think that sort of document would be incredibly helpful for those of you involved in reconfigurations or discussion about the future of your maternity services. We've got an RCOG, RCM joint officer meeting tonight when we'll start discussing the issue, and then there's another meeting on Friday where the RCOG, the RCM and the NCT are getting together. So watch this space on that one. The other thing that we've been working on a lot recently is still the health bill in England, and we've been lobbying very hard, and we're delighted that there was an excellent debate in the House of Lords recently where Baroness Cumberledge tabled some amendments to the health bill on choice, on maternity networks and on the standards for maternity services that might be included in the National Commissioning Board framework for clinical commissioners. And the good thing was that although the amendments didn't get accepted for incorporation into the bill, they were really what's called probing amendments, and we were looking for a response from Earl Howe that was positive for maternity services. And indeed Earl Howe made a very good response around those three issues, and we now believe we've got statements that we can follow through and push for action on. So that's all going very well. We had a very good meeting with Lord Caker yesterday in the House of Lords, who's going to push Earl Howe for further action as I've just described. And finally, since I last talked to you, I think we've been on the pensions rally, or should I say the strike, that was triggered by unions' dislike of the proposals around the NHS pension scheme. Clearly the RCM hasn't proposed or balloted on strike action, but we wanted to show our support for the other unions. I think it was a successful marches all across the country, across the 4 countries indeed, and we're now taking part in health-specific discussions about the pension and hoping that we can get some positive movement. So lots going on. I hope sorry, I hope everything's all right where you all are. Bye for now.